There are certain people who are walking around with all the risk factors and they don't even know that they are at risk of developing an addiction, even before they've ever used anything or drank any alcohol. I'm going to tell you what they are and the things that you can do to reduce your chances of developing a substance use disorder. So the first one is if you have any mental illness, and that could be depression, PTSD, anxiety, or ADHD, anything like that, it makes you predisposed to developing a substance use disorder. Another one is any trauma that you experienced as a child. In fact, we have a questionnaire that we do with every single patient who comes into this facility. It's a set of questions that we ask people to determine how many adverse childhood experiences they had before they turned 18. So if you want to know more about that, just ask. Another risk factor is totally not fair, but is being a female. Women use smaller amounts of substances less frequently than men, but because of our biology, we tend to develop an actual addiction quicker than men do. Genetics. Anybody in your immediate family who has an addiction makes you more likely to developing addiction. So far, I've given you a list of things that you have no control over. I'm going to give you one that you do have control over, and that is the age at which you first use alcohol or drugs. People who use drugs in their late teens, early 20s for the first time are less likely to develop an actual addiction than, say, somebody who uses drugs when they're 13, 14, 15. There's one thing you have power over. You can control not using or drinking until you get into your early 20s. There's several more, but for the sake of time, I'm going to say goodbye for now. And if you want to know more, please give me a follow, and I talk all about addiction, recovery, and the side effects of addiction, aka prison.